Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We have a lot of topics today. Several of them have to do with software and artificial intelligence or machine learning and advances in healthcare. So let's start with that. Oh, but before we do, down below in the YouTube description box will be a URL address or a link to the Healthcare Advocacy newsletter. You can sign up for free there, and all of the studies and references. And a lot of times when I have medical news, I'll have a link to the scientific journal that published it, so you can go read it if you like. Okay, let's get started. Let's first talk about lung cancer detection and artificial intelligence. Researchers from the University of Cologne, Faculty of Medicine, and University Hospital Cologne have created a digital pathology platform based on artificial intelligence. The platform uses new algorithms and enables fully automated analysis of tissue sections from lung cancer patients. It's now possible to analyze the digitized tissue samples on a computer for lung tumors more quickly and more accurately than before. The study has been published. It's in the journal Cell Reports Medicine, and there's a link to that, of course, and to the press release from the University of Cologne. Let's talk about ChatGPT detection capabilities. In radiology, diagnostic imaging requires specialized knowledge to interpret the findings associated with a wide variety of diseases. Now, researchers at Osaka Metropolitan University compared ChatGPT to radiologists' ability to diagnose. Now, in recent years, generative AI models like Chat Generative Pre-trained Transformer, so-called ChatGPT, have shown potential as diagnostic tools in the medical field. They're good, but additional tuning is required. I include a chart, it's actually in the newsletter you can look at, and what they discovered was that experts, so in the field radiologists, were about 10% better than medical residents, and the residents were about 2% better than the software. But in between the two, grand total, there was a 12% difference or so. So residents were just about as good as the software. So what this means, what the study suggests, is that its performance, ChatGPT as a diagnostic tool, well, you better do a little more understanding of it first before you use it as a complete diagnostic tool. For now, experts are still best. But you know what? It's coming along. Anyway, the findings were published in a journal called European Radiology, and of course there's a link to it in the newsletter. This one, next story, has to do with childhood heart problems, and I got to tell you, a cousin of mine had this, and it is very dangerous. Children that are born with defects that impair the heart's lower chambers typically undergo a series of invasive surgeries very early in life. The first surgery generally includes implantation of a plastic tube called a shunt to improve blood flow. However, as the child and the heart grows, the shunt has to be replaced several times to accommodate the growing body. Now, researchers have designed a shunt that expands when activated by light. It is fiber optic. This is so cool. If they actually develop this into a product, this device could reduce the number of open chest surgeries that these children have to receive. Today, without these surgeries, these children die. I mean, that's the end of it. However, with the surgeries, they still have significant risk. There was a study done of about 360 patients who underwent the initial heart reconstruction procedure. 41 needed additional surgeries to implant a larger shunt, and 7 died as a result. So you can see this is significant risk. The next test that these researchers are going to do is of the light expanding shunt is in an artificial setup in the lab that mimics the human circulatory system. This is so much better than going to animals right away. Anyway, if those are successful, then they'll head over to an animal model. If you want to read their results, it's in the American Chemical Society Journal, and of course there's a link to it there. The next topic I have for you has to do with Project 2025. Excuse me, Project 2025 was sponsored and written by the right-wing think tank, the Heritage Foundation. And of course, there's a link to their 922, I think, page document. You can get it there. It was written by 400 conservative so-called experts, and it was published in a book form titled The Mandate for Leadership. The Conservative Promise. That's the whole title. Mandate for Leadership, The Conservative Promise. Many of the core proposals were actually written by former Trump staffers, like a lot of them. I wanted to know, how does it affect healthcare? So let's talk about it. Number one, it will halt prescription negotiations that the government has been involved with. At a time when a third of Americans report not filling a prescription because of cost, Project 2025 calls for halting federal negotiations of drug prices, like the one that capped insulin at $35 a month for seniors. That, if you're looking, that's on page 465. It also calls for Medicare to be replaced with a default Medicare Advantage program, page 464. This will inherently cost more because the overhead at private insurers is about 20% or so. However, Medicare, traditional Medicare, has an overhead rate of about 2% of claims paid. That's really important because when you hear me talk about universal health care and HR 3421, $400 billion of those yearly savings come from eliminating that overhead. Anyway, it's a huge giveaway to the insurance companies at patient and taxpayer expense, and it masquerades as free choice. It isn't. Actually, traditional Medicare is free choice because you can go anywhere. I digress. It will restrict Medicaid. It also seeks to weaken Medicaid, which more than 70 million low-income Americans rely on for health care. Project 2025 proposes instituting lifetime caps on benefits and adding work requirements as a condition of coverage, creating administrative hurdles that make life harder for people who actually have the least. Together, these provisions will cause millions of people, including many who are currently working, to lose coverage because they won't meet income requirements. They're going to mess with that. Anyway, this is especially true in the 10 states that have chosen not to expand Medicaid. These policies are built to punish patients for being poor, and in one of the harshest ways, by denying medical care. You know what? If you want to read about it, page 468 in Project 2025. Reproductive rights restrictions. Project 2025 would not only further restrict abortion at the national level, but also eliminate no-cost coverage for some contraceptions. It will erect barriers to evidence-based care for patients of reproductive age. And there are actually, I couldn't give you all the page numbers. Here's why. You can go look at page 458 and elsewhere, but I did a search in the document, just on abortion. 199 references in the document. Give me a break. Let's talk about the damage it'll do to children. The authors of Project 2025 want to prevent public health agencies from requiring vaccinations in school children. This could cause more outbreaks of preventable and serious diseases like measles. You can find that on page 454. They also propose invalidating state laws intended to stem gun violence. I include a link to it in the newsletter, but a large part of what they want to do is have open carry everywhere. They want to eliminate laws that preclude open carry of weapons. This is really serious because one of the leading causes of death for children in the United States is gun violence. Project 2025 would also eliminate Head Start, which is a critical program for early childhood development, especially in low-income and rural communities. You can find that on page 482. Summary. Project 2025 poses a frightening vision of the future where most people are again relegated to the status of a disposable resource. Health, education, personal autonomy, bodily autonomy, financial protections, worker rights, pollution controls like having access to clean water and air, all of this will be lost in the so-called name of freedom of choice. But it's really a hoax. And it's a very cruel hoax because we and our children will be victims for a very long time if we allow Project 2025 to go forward. Particularly frightening is that so much of Project 2025 can be implemented only by the executive branch without any other oversight or authorization from other branches of government. That's a stroke of a pen. They can do all of this. And we need to make sure that they don't. Here's the action for today. It's not calling your representative. It's not calling your senator. It's call everybody you know and let them know what's in there. And then vote accordingly and ask others to vote accordingly so that we don't have to live with this. Okay, I got news for you. If we're going to win this, it is up to all of us. That's what I've got for you. Down below, like, share, subscribe, send me comments in YouTube or at healthcareadvocacy1, all one word, @gmail.com. Thanks. Have a good evening.